Back to my channel. Please remember to subscribe, like, and share. This is part 2 of Dr. Kelly's presentation for the AIDS Day Seminar in Recognition of World AIDS Day, observed annually on December 1st. Dr. Kelly delivered an informative and educational talk about PrEP and other medications that help manage the virus, as well as practical tips on how we can protect ourselves. Please enjoy the presentation.
Cisgender and transgender women. Anybody know what cisgender and transgender women mean? What the trans mean? Tell me what who's a transgender woman?
A man killing a woman.
So you're born a male and you transition or you decide to become a female. So if that's what a transgender woman is, who's a cisgender woman?
A female that's going to be a woman.
No. So whenever you hear cis means straight or in the same path, while trans means going across or cutting to a different path. So a cisgender woman is someone who was born a woman and she continues to be a woman. Make sense? So by that logic, who is a cisgender man?
A man is born a man and a be a man.
And he might be a man. Who is a transgender man?
Man is one big woman.
Who is a transgender man? So you're born woman, but you convert to man. Alright? And there are different ways they do those stuff. Alright? And it's important because you need to know these terms. Alright? Because you're going to go into the real world, working world, people going to talk things you say you wonder, you can't get ignorance. My job is to make sure you understand the things before you go back out. Alright? And make sure any question you have, you're keeping them in your head because I'm going to answer them. So, you get this benefit when you take it as prescribed, you are protected. If you don't take it how we tell you to take it, we can't promise you nothing. It's not our fault. The medicine tells us, the science tells us, when you take it every day, the 1 pill per day, which is actually 2 medications in 1 pill, you will be protected. If you choose to take it whenever you choose to take it, it's like you're not following the instructions. So we can't help you with that. So my advice to you, take it how you're told to take it. Alright? So PrEP is a part of a comprehensive plan or sexual plan to have safe sex. But PrEP is not the only thing required in that plan to have safe sex. What else is needed? Condom. Yes, I can't sell it enough. As much as PrEP will prevent HIV, PrEP will not prevent anything else. It will not prevent baby. It will not prevent syphilis. It will not prevent gonorrhea. It will not prevent herpes. It will not prevent chlamydia. It will not prevent trichomonas. It will not prevent no other sexual infection except HIV. So what will prevent that? Your condom. Makes sense, right? Something as simple as $150 for a pack of 3 can prevent every other sexual infection. And if you actually go to your clinic, it is free. You can get as much as you want. Once the clinic have it, of course, condom free. So, I'm going to pause here for a minute. And I'm going to talk to both the ladies and the men. Alright? I'm going to start with the ladies. Ladies, stop make boy pity take you for idiot. Long story short. Stop make boy pity take you for idiot. Enough time them want to say them don't like how the condom feel. If him don't like how the condom feel, and I tell this to all my female patients, I am an HIV adolescent treatment officer. What does that mean? It means I say people of your age group up until 24 who have been diagnosed with HIV. A majority of them get it through sex. So I'm telling you from experience, you have the power. If the man say he don't want the condom, you have the power to lock up your foot. If him say one next, tell him to find somebody else. You have the power. And I'm going to flip the switch now. Men, stop being so quick to insert without a condom. No matter who it is, especially if somebody just met me for the first time and you're in the heat of the moment. Stop being so quick to insert without a condom. There are certain things that you cannot come back from. HIV is one of them. I can't stress it enough. Stop being so quick. Practice safe sex. I'm not going to tell you no have sex, but that's not my job. My job is to ensure that you have safe sex and you understand exactly what that means. But you can't leave here today and plead ignorance, say you never know what HIV was, you never know what PrEP was, you never know why condoms were important. Please, I can't stress it enough, have safe sex. So, like I said to you before, it's 2 drugs in one, and it works pretty well. Certain groups will get more benefit in terms of the numbers than certain groups. So whenever we talk about MSM, we're talking about men who have sex with other men. Or when we use TG, we're talking about transgender women, who are transgender women? Man that changed to a woman. Alright? So they're the ones that actually get the most benefit. But nonetheless, a heterosexual, aka a straight couple, is going to still get lots of benefit, and they can get the 90% and higher as well once they're taking the medication every single day at the same time, every single day. You will reap the benefit as well. Alright? So, there are seasons of high risk. I'm not going to tell you when those seasons are. You know the seasons. But there are seasons when you're more likely to have sex than seasons when you're less likely to have sex. You see, especially in those seasons of risk or high sexual activity, may I beg you, please be safe. PrEP is free to everybody. Once you're 16 and over, you can walk into any clinic and tell them, without an adult, tell them that you want PrEP. They will ask you some questions, they will do blood tests, but you can get PrEP free of cost. You don't have to spend a dime apart from the dime to reach a clinic. Free of cost. All your excuses are being taken away. So, like I said to you before, this cycling on and off for PrEP can't work. Can't take the pill for 3 days and then you stop because you don't want to take no more pill. The medication is going to be pointless, and you're going to put yourself through some side effects that really, what was the sense in taking the medication? If you're going to take a medication, take it, forget the purpose now. Otherwise, you put an unnecessary pill in your body for no reason, right? Right? Alright, cool. So, let's see how fast your eye. Anybody want to estimate how many people living with HIV? You look quick, man. Alright, so 30,000 persons currently are estimated to be living with HIV. Alright? 30,000 persons right now that we know of have HIV. I can tell you the number is much bigger than that. Alright? Well, it's only estimates we can do based on certain formula. But the number is much bigger than that. And look at this. So roughly 1.4% population in the population diagnosed with HIV per year. Alright? 51% are transgender people, and 30% are those who are MSM, which is men who have sex with other men. Look at this figure. Of the 749 new cases, 23% were female in what age group?
15 to 24.
15 to 24. And 25% were males in what age group?
30 to 39.
Look at this. In 2018, there was a 60% of the new cases were attributed to what age group?
15 to 24.
15 to 24. Anybody here younger than 15? No. Anybody here older than 24? So who does this apply to?
We.
You. Put it personal, teenagers, but you. It applies to you. You are not removed. Data shows us that you are the ones most at risk. It's not your parents, it's not your uncle, it is you. And the biggest reason behind that is because you're having unprotected, high-risk, unsafe sex. And the reason why you're having these things is because you don't have the knowledge about what is safe sex. Knowledge is power. Once you have the knowledge, you can make wise decisions. Knowledge is power. Alright? Don't feel like this is something only adults. That's to answer all your questions. Don't feel like this is something only adults can catch and it's an adult problem. Alright? I have at least 80 people on my adolescent HIV roster that I treat. So it's not far gone that you can catch it. Alright? If you weren't born with it, you can catch it through sex. So, as I said to you before, ladies, Your biggest age group that contribute to you is 20 to 24, then 25 to 29, then 15 to 19. Men is more on the 30 to 34. So I know some of you might feel that, oh, 15 to 19. But good man, I don't know how we get there. The problem with that is, it's not that you're not catching it enough. It's that you're not doing the test until you reach 20, until you get older. When 10 more years kick in and you start turn wise in your senses, that's when you start to test. So don't be fooled by that data. You still catch it as a teenager. You just say you're not doing any checks. You're not going to the doctor until you finally get to your working age, and then you decide to go check a doctor to make sure everything alright. Or somebody give bad news and you say, oh, I'm going to check to make sure everything alright. So don't be fooled. You are catching it as well. Alright, so PrEP is a pill that's taken daily. It's for everybody. Purpose is to prevent HIV, as we said before. There's this new thing on the market, right? Human beings always trying to find new ways to make science more efficient, and then do a whole heap of studies to back up this new thought. So we already know that we don't like whole heap of pills. So they're trying to find, can we cut down the pill count? Well, there's actually something called event-driven PrEP. What is event-driven PrEP? Long story short is, you know, sir, at some point in the future, you're going to have unsafe, high-risky sex. I wasn't putting the high-risky, just unsafe sex. But you know, sir, you're not going to turn away from that because you really want it. Event-driven PrEP is actually there for you, where you can plan in advance and take medications from in advance to actually prepare so that you don't catch HIV. So what it looks like, you take 2 pills 2 to 24 hours before the intended sex. So if you have plan to have sex Wednesday, you take the pill Tuesday, 2 to 24 hours before. Then a pill each day, each following day, 2 days after the last potential sexual exposure. So MSM, everybody know what MSM are, right? You remember what I said?
You know what I know that.
Alright, so though it is not because I still have to teach you everything now. People will tell you things and then nothing goes so. Alright, so though it's made, because the studies are mainly for MSM, you still have to know what event-driven PrEP look like. Alright? And it's really 2 days after the last exposure, that's when you continue taking the pills. So, I'm almost near the end. We talk about PrEP, which is P-R-E-P. Anybody want to take a guess to tell me what is PEP? P-E-P? It's a different thing altogether. What is PEP? And no, it's not primary exit profile. Someone said that in the previous group. Too smart. What is PEP? What is the opposite of pre? Post. So what is PEP? Post-exposure prophylaxis. What is ART?
After.
It's all like it will be after, right? So ART is actually antiretroviral therapy, alright, or treatment. So, long story short, PrEP is to prevent you from catching HIV. PEP is after you've been exposed, whatever means, after you've been exposed, and you're within the 72-hour window period. Note I did not say 3 days, I said 72 hours. After 72 hours, we can't promise you that the medication will work. But once you take it within 72 hours after the exposure, so within 72 hours after unprotected sex, within 72 hours of receiving contaminated blood, within 72 hours of using an infected needle, once you go on PEP for 28 days, not start and stop, but 28 days straight, you should not get HIV. You will still do a repeat test, but you should not get HIV. And ART, or antiretroviral therapy, is for persons who have been diagnosed with HIV and now need medication to keep the virus under control. This is 1 pill. This is 3 pills in one, or 3 medication in 1 pill. This is 2 medication in 1 pill. This is 3 medication in 1 pill. So you need to know where you fall, because the treatment will be different. And if you give yourself PrEP for PEP, you're going to have problems. It won't work. If you give yourself PEP for PrEP, you're going to have problems. It won't work. That's not what the data suggests. Okay? So, who can benefit? Anybody that's having vaginal or anal sex without condoms. That's high risk behavior. Anybody that has more than one partner. Partner is anybody that you have sex with. No matter if it's a boyfriend or a girlfriend. Once you have sex with them, they're your partner. If it's more than one person you're having sex with, it is high risk behavior. Alright? And anybody that has been exposed by any of the other means, if you're consistently having recurrent infection, so ladies, if you're consistently having vaginal discharge and doctor says a sexual infection, or gentlemen, if you consistently see pus coming from your penis, or you're burning when you pee, and doctor says a sexual infection, you will benefit from PrEP. Alright? Because if you're catching one thing,